So ain't nothing wrong, okay?
Good evening, and welcome to this episode of the Black Scientist Cooperative Podcast. This evening, we have Dr. Nikita Barnes, a person who is near and dear to all of us, and we've known her since our days at Meharry through Dr. Williams. Welcome, Nikita. We'd like to start off by you telling us a little bit about yourself and how you came to be a doctor, a sister doctor, and what that looks like for you right now. So if you would just give us a little bit of background about yourself, that would be great.
So I'm Nikita Barnes. I am a nurse practitioner with the Pulmonary Critical Care and Sleep Medicine department. I've been doing sleep medicine for about 10 years. I got into this field as someone who started off doing critical care and pulmonary disease, and I found sleep medicine and just loved it and just definitely dove into it because I love the fact that with getting into the history of someone and how they sleep and treating their sleep disorders, how much of a difference it can make in someone's life.
Awesome. So this evening, if you haven't deduced already, we'll be talking about sleep disorders and how they affect the Black community. Dr. Patterson, would you like to take us into our first question of the evening?
Yeah, I definitely want to, I'll kick us off. But before I do kick us off, Nikita, can you tell us a little bit about your doctoral work and how you your doc?
So I did my doctoral work. I did my doctorate in nursing practice, and my research looked at how does text messaging affect the adherence rates for patients to show up at their sleep study. It actually brought more patients to the sleep lab, and we were able to identify patients who were more frequently likely to not attend their appointments.
Great. So let's kick it off by, I like to kick things off by us really understanding what sleep disorders are. Like commonly in the Black community, you don't hear about sleep disorders. You hear about stuff like diabetes, which we nickname sugar, hypertension, high blood pressure, that kind of stuff. But rarely do you hear folks sitting around the table talking about their sleep disorder. And so if you could begin by giving us a definition of what sleep disorders are and maybe some signs that people should look for, telltale signs.
Thank you for having me. One of the things as far as a sleep disorder is going to be anything that is going to affect the amount of sleep, the duration, and the quality of your sleep that will often result in the following daytime having issues with coordination and just excessive daytime sleepiness as well. So when we look at sleep disorders, the most common that we often hear of are insomnia, narcolepsy, where people fall asleep very quickly. We hear restless legs, but one of the most common is obstructive sleep apnea. So one of the things I think when we are looking at what are some signs that we should be aware of, a lot of times there are times when we're just tired, whether that is life stress gets in the way, we don't have a good night's sleep. But can we, the next couple of days, kind of catch up on our sleep and feel refreshed? People who are sleeping 7 to 9 hours a night and still waking up not feeling like they're refreshed and they don't feel like they have slept at all or don't feel any better than when they went to sleep, that is a problem.
So when should someone decide to go get a study or seek medical help?
We use a screening tool called StopBang, and that is STOPBANG. And that screening tool will go through what each one of those letters mean that lets you know, are these problems that you should bring up to your provider? S being, do you snore? Has somebody ever told you you snore? T is, are you tired? Are you tired the next day? Again, so you have slept an adequate amount of time. You feel like you should be rested and you're still tired. O stands for, has somebody ever observed that you don't breathe well when you sleep? P is for pressure. So if you have issues with your blood pressure, are you already on blood pressure medication? B is BMI. Is your BMI greater than 35? A is age. So as we think about the muscles around our neck that control our breathing when we sleep, those muscles aren't going to get any better as we age. So 50 is an age we really start looking at as a cutoff. G is, is neck circumference. So if you take a tape measure and you measure your neck as a woman, if it's greater than 15 inches, or as a man, greater than 18 inches around, those are things that you should be concerned about. G is gender. So as a man, males have more increased sleep disorders. And so if you're adding up those 8 things that I listed, and you have counted that you have at least 3 or more of those symptoms, you should bring it up to your healthcare provider and mention that you think something's going on with your sleep.
Child, you're gonna have me measuring my husband's neck tonight.
I often ask wives, because usually the wives are the people who know about their husband's necks, because they're the one buying those collared shirts. So I'm like, hey, what's your neck size? Because when you buy those collared shirts, those are going to give you that 18 and a half, 19 and a half. So.
That's so good to know.
So I'm going to dive in here because I know that I don't get a lot of sleep. My day starts, my alarm goes off at 4 a.m. And then I'm going nonstop. So I think, and by the end of the night, I am dead. So truth is, I'm tired. But I think like I wouldn't know if it is a sleep disorder or that my body is suffering from that. So what happens to the body when it is chronically sleep deprived?
That's a good question, Shantae. So our bodies are not meant to live off of a little bit of sleep. We are, as adults, we are meant to get anywhere from 7 to 9 hours of sleep a night. And when we don't, small things happen, even if it's acutely. So if you've ever been super tired and know that you've gotten a little bit of sleep, your mood changes, you're more irritable, your concentration becomes an issue. There are times when you have gone where you've not been sleeping well, and then you're more likely to catch colds. So your immune system is working in overdrive to catch up with the fact that you have not been sleeping. We also can experience some chronic pain because we don't sleep well. The other big thing that is a big component that Marlon brought up that we talk about in our Black community, diabetes and high blood pressure, but often sleep deprivation can cause those issues to be exacerbated. So our bodies are smart enough to know that we are not sleeping well and something's going on. So when we don't breathe like we should at night, and if I kind of relate it to like if you were in a pool and you were drowning, your body doesn't need it. You don't need to tell your body, hey, we got to fight to stay alive. So our body knows, hey, something's going on. So we're going to make it so that we don't get into those deeper stages of sleep when a lot more breathing issues happen. So we're going to come out of that. So when that happens, and just kind of think about like this whole drowning scenario, when you do that, your heart rate goes up, your blood pressure goes up. So that puts a strain on your heart, that puts a strain on those vessels. So it puts you at increased risk of having strokes, heart attacks, and difficult to control blood pressure. Also, when that happens, you have, our bodies are going to dump out sugar into our bloodstream because we know, hey, we got to fight, we got to stay alive. However, we're not moving or doing anything. So all that sugar is just in our bloodstream that's going to make our glucose, those blood sugar levels creep up in the morning. So a lot of times when you have patients who have high morning fasting blood sugars, despite taking the medication and dietary changes, it can be related to untreated sleep issues.
Wow.
So,
Okay, go ahead.
Charlie, I do want to have a piggyback question to something you said regarding your quality of sleep. And when you talk about quality of sleep, can you expound on what you mean by quality of sleep? Like, what determines whether or not you're having good quality sleep?
So when we sleep, we cycle through sleep stages. So we cycle through 4 different sleep stages. So one being very light sleep, to our deeper sleep, to what we call our REM sleep, that rapid eye movement sleep. And as we age, we have less of that rapid eye movement sleep anyway, but we want to really try to make sure we get that deep sleep. And that's that restorative sleep, that sleep when you wake up and you feel sleep, and that you have slept well. The problem is when you have any type of events that stop you from sleeping well. So whether that's not breathing or even restless leg symptoms, that movement in your legs that wake you up, it's going to move you from that deeper stages of sleep. So when you have lighter sleep, so you're actually getting the sleep time, it just doesn't feel like you have slept well.
Okay, so Nikita, earlier you mentioned your stop bang tool. And in that tool, you mentioned that there are gender differences. You mentioned just a little while ago that there are associations with age, BMI, and neck circumference. There are lots of different factors that you explained to us that can ultimately culminate into some type of sleep disorder. So my question now, and I don't know if it's sort of inherently embedded within the tool or if this is something that may be anecdotally true or maybe backed up by research, but is there also a racial or ethnic disparity in the development of these sleep disorders?
There is a racial disparity in sleep issues. So even the amount of time that we sleep, the CDC has done statistics that list out people who have short sleep cycles. And when I say short sleep cycles, that means people who sleep on average less than 6 hours a night. Whites, in compared to Blacks, had a higher incidence of having less sleep than their white counterparts, anywhere from 35 to 60 minutes on average per night. There are several things that add to that issue. One being Blacks are more likely to work shift work. So, and when I say shift work, so work nights or work more than 40 hours a week and have a second job, or shift back and forth from nighttime to daytime work. So then that makes it so that we don't get as much sleep. The other issue in poorer neighborhoods is you have problems that cause inopportune sleep, such as lights, noise, air pollution, irritants, that are more likely to be in poorer neighborhoods that often where African Americans live.
So
So
it
can I
sounds
ask-
like, okay, go ahead, Shante.
So Nikita, what about healthcare professionals? So you have surgeons, you have doctors that, are up, 24, 36 hours, sometimes longer than that. Can you talk a little bit of the consequences of not getting good rest in the health profession?
That's a great question, Shante. So in healthcare, that's one initiative that they have really tried to bring into the residency programs of making sure sleep is being discussed and the importance of sleep. One thing that we definitely see are there more mistakes made when people have not slept very well. And we see that even in something as common as needle sticks. So needle sticks, when they look at when needle sticks were happening, they saw it was happening more in the middle of the night or as people had been up more than 24 hours. And so that's one of the reasons why they have tried to institute stricter time frames with residency education.
And so do you see an increased rate of sleep disorders in healthcare professionals? Or is it just a one factor that they kind of carry, which is the lack of sleep, but not maybe like a lot of the other 7 factors that you mentioned earlier?
So there's also a screening tool, the Epworth, that kind of mentions how likely are you to fall asleep. And so I think when you have those type of jobs that that have longer hours, you're more likely to be sleepier, but that doesn't always equate to you having a sleep disorder. So that's somewhat what I'm a little hesitant of, like, how do I answer your question as far as healthcare workers? Because I think if you look at people who are definitely doing those longer shifts, they're going to have more issues of being tired, but that doesn't truly mean that they have sleep apnea or other disorders.
Gotcha. And then thinking about, okay, so in the idea in the disparities between Blacks and whites, so it's not really anything biological or genetic or anything like that. It's really about more of the environment and maybe even income and type of profession that's really driving that disparity between Blacks and whites.
And even our obesity. So how we carry our weight matters when we're looking at sleep issues. So people who carry more weight around their neck, around their waist, around their breast area are going to be more likely to have sleep issues. So when you really talk about true genetics, there are very, very few true genetic sleep disorders. Often it's more related to how running families is we all look alike. So sometimes it can be the shape of your mouth. So if you have a small mouth or a large tongue, that can be something that's going to block your airway during the night. So that may be more genetic because that's what we all look like. People who also smoke very heavily or drink very heavily also have an increased risk of having sleep issues as well.
Gotcha. And then, like, so what are some of the treatments for that might be prescribed for some of these sleep disorders? And then do you also see a difference in adherence rates to these treatments between Black people and white people?
So before we talk about treatments, I want to kind of talk about how we diagnose sleep issues. So I feel like it's very important that, one, we have to be the people who bring it up to our primary care provider, letting them know, okay, I am tired, something's going on. Once we do that, then they can either send you for a sleep study. So there are two ways that we do sleep studies. So one is they can send you to a sleep facility, so like in hospital, where they're going to put all of this specialized equipment that's going to monitor your breathing and your brain waves and kind of figure out and talk about going back to that quality of sleep. So we'll be able to tell what stage of sleep you're going into. They'll watch you sleep and get the diagnosis there. There's also a way you can do it at home. So you would take this device home that looks kind of like a seatbelt. It'll wrap around your waist and monitor your breathing. There'll also be this thing that'll go on your finger, a pulse oximetry that'll monitor your oxygen, your heart rate. Then this thing that sits in your nose that's going to monitor the way you breathe. And so what goes on in the sleep study is we look and see how many times do you slow down your breathing in an hour, and we monitor that and determine how severe if you have sleep issues. So treatment of sleep apnea can include 4 different things. So one being the CPAP machine, where you wear the machine on your face that's pretty much going to blow air into your airways, that's going to keep your airway open so that you can breathe. The other option is a oral appliance. It looks like a retainer, and what it's going to do is kind of bring the bottom of your jaw out a little bit to give you more area to breathe. The other option, well, there are 2 surgical options. So one being where they place a device that they place in your chest, which sends a wire to the nerve that controls your tongue. So if the area of obstruction is around your tongue, it sends this impulse to your tongue as you sleep to move your tongue out of the way. The last option is a surgery that they would take out your tonsils. They'll also take out your uvula, the little thing that hangs down in the back of your throat, and also kind of shave some of the top area of your mouth to give you more area to breathe during the night.
So Nikita, just I have a question. So earlier you mentioned that there was this sleep study that you can do at the hospital, or a sleep study. What did you call it?
A home sleep study that you can do at home.
It's the one at home, and it's one that you can do at the hospital, correct? have you noticed that? Because I know for me, it would, I don't know if I would have a good night's sleep because I'm not in my own bed, in my own space and stuff. So how do you, I guess, account for the fact that you're not at home in your own bed and in your own environment when you having to do the sleep study at the hospital versus at home in your bed?
So we do see different stages of sleep. So sometimes people are not able to get as well of deep sleep as they would be at home in the sleep lab. But however, with the home sleep study, it's really good to just say yes or no. So it's not going to tell us your stages of sleep. So it tells us yes or no whether you have a sleep disorder. And so there is some benefits of saying yes, you're in your own home. But usually I will say I do encourage my patients before I send them to the sleep lab, try not to take naps during the day. Try to, get up a little bit earlier so to make sure you are fatigued during the day so that you can try to get the best amount of sleep in the sleep lab.
Okay.
I actually have like one more question that our audience probably be interested in. Nikita, what's like your perspective on sleep aids? A lot of people use sleep aids when they can't sleep. I saw a lot of that, especially when I was in my MBA program. Is that safe?
Sleep aids are good in a short amount of time. My biggest issue with sleep aids become people who are using sleep aids and have not been tested for any type of sleep disorder. Because if you are already stopping your breathing at night, you add a sleep aid, which then decreases the amount of times you're going to breathe, which can cause more issues to how effective your breathing pattern is when you sleep. So often I'm very conservative in giving out sleep aids until I have ruled out all other causes of sleep issues, because I don't want to add another problem from the medication if you're already having sleep breathing problems.
And can we just define like the gamut of sleep aids for those watching so that they know what you're talking about specifically, or some examples?
So sleep aids, when we're talking about sleep aids, over-the-counter medicine, so melatonin. Some people take Benadryl. The ones I'm more concerned about people taking is more of the prescription medications, such as the Ambiens and the Xanax that people can take, that they get for another reason, and often will have issues where their breathing is affected during their sleep and may exacerbate untreated sleep apnea.
Thank you.
I think this has been an excellent education. I want to just really, rally and petition to our viewers to really take these things into consideration. Sleep apnea is real. I had a relative that has sleep apnea, and he stopped breathing in his sleep study 85 times over the course of the night. So I think that, it's important that you advocate, for yourself to your doctors. If you see that your spouse, is like Nikita said, use that stop bang to really assess whether, you need to talk to your physician about getting a study.
Does anyone else have any last questions for Dr. Barnes? All right, ladies and gentlemen, thank you so much for joining us this evening for the Black Scientists Cooperative Podcast, and we will see you soon. Have a great evening.
Have a good evening.
Bye.
Thank you.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life bright. I'm so glad that you're mine, yeah, 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 yeah.